Hello, my name is Leah. I'll be your nurse today.
Hi.
Hi, how would you prefer that I address you?
Just Nisha's okay.
Okay, and what pronouns do you use, Isha?
She, her.
Okay, thank you for that information. Let's see. Administer morphine Q4 hours PRN for pain. Administer heparin for DVT prophylaxis. Ambulate patient EID. Disha, I'm going to step out of the room for just a moment. I'll be back to check on you shortly.
Okay, thank you.
Hi, Elon. I have a question about my patient. Can I ask you a quick medication question?
Yeah.
Thank you. So my patient sustained a head injury 3 days ago, which resulted in an intracranial hemorrhage. She just had a surgery on her leg, and the physician ordered heparin as DVT prophylaxis, but I'm worried about administering the heparin to a patient that had a brain bleed. Is this safe?
I would not recommend the administration of heparin, as this patient is at an increased risk of bleeding following their head trauma.
That's what I was thinking too. Hi, Solano. Do you have a minute to discuss a patient?
Yeah, of course.
So this patient is 48 hours post-op for a compound fracture of the distal femur. I have orders to ambulate her BID, but they don't specify any assistive devices or whether or not she should be weight-bearing, and I just don't know how to safely ambulate. None of this was included in the order. What do you think is best for this patient?
Yeah, so I think that this patient shouldn't be weight bearing on their affected leg, and they should be ambulating with assistive devices. So if the patient would like to stand, they should do so with the assistance of crutches and at least one other person at the bedside to help them up. I think you should also clarify the written order with the provider just to prevent any further injuries or any falls.
Hi, Dr. Desai. I'm the nurse caring for Disha today, and I have a couple of questions about her care. The orders say to administer heparin, but due to the risk for increased bleeding and the recent history of the intracranial hemorrhage, I was just wondering if this should still be administered.
The order says heparin, correct?
Yes.
Then you should give heparin. You're the nurse. It's not in your place to question what medication I prescribe for the patient. I know how to treat a patient with hemorrhage.
Okay, and I also just wanted to question the order for ambulation. It didn't specify whether the patient should be weight-bearing or using any device. How did you want the patient to ambulate?
I wrote all the instructions for the patient in the order. You should follow that. Do you know how busy I am and how many patients I have to see today? I can't be dealing with all these questions. I don't have time for this. If you can't do your job, then maybe you shouldn't be here.